Yeah? If you have a child who presents to you at 12 to 14 weeks, and they're night waking, and they're screaming, and they're not settled, and they're inconsolable, my top diagnosis is probably cow's milk allergy and not colic ever, because you can see the differential in colics. Nighttime crying, if you look at what happens in a 6-weeker and a 12-weeker, it's very, very different. So colic, you should be teaching your general practitioners about colic. And you should be teaching them what reflux. Reflux is a very, very common benign event. They just puke, it's regurgitation, and as well as teaching them about cow's milk protein allergy. So if you have to teach them and train them, that guideline, the MAP guideline, was taken, and Trevor Brown, who's a general pediatrician, a very passionate general pediatrician, he had retired, but he wanted to stay busy. So he loves golf, so he just chose the various golf clubs, courses all around Northern Ireland. And what he did is he said, right, there are 10 GP practices, general practitioner practices around this golf area. I'm going to spend a few days there. And he literally used to go and train them for half a day each on all these topics. And this is what his impact was. So we recognize Nadia Lazinski, who works in Sydney at the moment. She's a Brazilian doctor, and she said, well, this is a survey of every single child in the UK, and the current management pathway was completely mad. Mums were sitting there and trying to go to the general practitioner saying, please help me. I don't understand why my child is crying or fussy or screaming. And she showed the physician, and the physicians couldn't just wait to get them out the room. So as John said, he really didn't want the fussy babies. And they ended up with a whole host of treatments that actually are no good for you. They ended up with PPIs. They ended up with colic relief. They ended up with stay-down formulas and all these kind of things because they wanted to get them out of the room. Up to 18 healthcare professional contacts the mums and dads would have. That's a lot of contacts. And the time frame to get a diagnosis was at least 3.5 to 6.5 months after 18 contacts, with poor symptom control, poor quality of life, and really no faith in the physician. And what we really wanted was better follow-up, better diagnosis. So we presented this problem to Trevor, who's the golf-loving pediatrician, and said, could you change something across the whole of Northern Ireland? So what he did is he literally trained everyone, and he monitored using the MAP guideline, so it's validated, by watching prescriptions and watching diagnosis over a pre-training period, a post-training period, as well as how long the physicians would remember their ability to diagnose cow's milk allergy. So you take the guideline, one-pager, you teach them on lactose intolerance, reflux, cow's milk protein allergy, and then see if they can remember to diagnose and re-challenge and follow a guideline. So not just a guideline, but trying to validate it. And what he showed was this, is that the numbers of what we call useless prescriptions, so these are the things that don't work in cow's milk protein allergy, like PPIs, went from 250,000 down to 110,000. This is the training period, the pre-training period where there's high prescriptions. He then trains everyone, goes to every single golf course in Northern Ireland. Then it's a sustained knowledge improvement. So you can, with training, use a guideline to improve practice. But it will also increase the rate of cow's milk protein allergy because the extensively hydrolyzed formulations that were prescribed went from 8,000 up to 15,000 prescriptions, but the cost saving of this was far greater than the cost saving increase here. But the other thing, it was the emotional and the health economics of the numbers of visits that help the families and improve their quality of life. So, you can train and validate just with a little bit of patience and effort. Other tools that people are using, is the COMIS guidelines, so I'm a co-author on one of these, in which people are using scoring systems. I don't disagree with this. I think this is quite sensible, but the problem is that these symptoms aren't enough. it misses things like bloody diarrhea. And what Ivan van den Plas tried to do was validate it with a scoring system. This isn't sophisticated enough to really diagnose cow's milk allergy, but it's got a nice flavor to it, because what you're trying to do is quantify it for the physicians. So, a combination of something like MAP with something like this might, but a more sophisticated version of this, because this doesn't work, is that actually we may be able to have better tools in primary care to diagnose cow's milk protein allergy. So, validation, guidelines, simplicity, really important, but really you don't want to just blindly treat with the first formula you can find. You want to start thinking about, can I define severity? Yeah? And I always think, once you've defined severity, think of it like the asthma care guidelines. You start with your most intensive formula, and then you go down to the one that is the maintenance one. Yeah. If you had asthma, what you do is you hit them and get control. You might want to use a lot of inhalers. You might use your strongest inhaler, but you're not going to carry that on. You're going to go down to your maintenance treatment. And this is the way we should be thinking through in cow's milk protein allergy. Gain control, define severity, and minimize the treatments. We do it for every single other condition. Why aren't we doing it in cow's milk allergy? It doesn't make any sense to me. So you need some reasons why you want to not do that. It's because of these kind of ideas that people are beginning to think about what Roberto is going to talk about, is about tolerance acquisition. And we're now beginning to think about primary prevention, secondary prevention, and disease management by using probiotics, using small amounts of peptides to try and desensitize people, and you're seeing it in a very dramatic form with the LEAP studies now to prevent allergic disease. So keeping someone on an amino acid formula for no good reason is likely that you're not going to do anything good for the children. You're actually going to cause long-term disease where they haven't. So in the UK, things are changing. Yeah, there was this plethora and use of amino acid formulas, and then what happened was no one was following any of the guidance. So the MAP guidelines said, right, we can get people trained and see what we can do. No one was thinking about tolerance acquisition, and now tolerance acquisition is absolutely where you should be thinking. And I'm going to talk about something called atopic shifting, because what we're now recognizing is cow's milk allergy is not a short-term disease, it's a long-term disease. And what we really want to do is get early diagnosis, early intervention, and early prevention. So one consistent marker of severity, and it doesn't matter which guideline you look at, is weight loss. Yeah? Only 6 to 8.5% of children with cow's milk protein allergy will lose weight if you're in a developed country. Brazilian data from Mario Vieira is that 22.5% of the Brazilian children, because of poverty and malnutrition, lost weight with cow's milk protein allergy. So as people's standards of living go up, cow's milk allergy that is associated with amino acid formulas, with weight loss, should be treated with amino acid formulas, but with the principle that you're going to use intense treatments and then drop down to a lower grade treatment afterwards. And Roseanne and Karina, they published a year or so ago, and what they showed is absolutely reviewing all the literature. There are only certain areas of recommendation, and that is losing weight for the older people, eosinophilic esophagitis. They've failed an extensively hydrolyzed formula. If the mum was representing the child with lots of symptoms and exclusive, not mixed, but exclusive breastfeeding, where the baby, the amount of antigen that is going through in the breast milk is so low that it's very similar to an extensively hydrolyzed formula. But the big one, so this one, atopic dermatitis, there's actually not a lot of evidence for this at all. But what they really reported was that when there are multiple gastro symptoms and screaming and irritability and back arching and eczema and the child's pooing 15, 20 times a day and got red bums, then multiple GI symptoms could be an indication. So I then get involved in this article because of this thing. So could we delineate an easy way for the physicians to actually remember what kind of indications for cow's milk allergy? So we came up with this So his beautiful wife is what we called it. And his beautiful wife, everyone's got their cameras on this, let's see, is measure their height and their weight. Yeah. If you see problems of height-weight ratios going wrong, see. Irritability. If that parent is sitting in your room and their quality of life is so poor, you're not going to wait for an extensively hydrolyzed formula to fail. You want to gain control of the situation. You want to improve their quality of life, and it doesn't have to be for long. So, irritability. Sleep. John shows you beautifully, and I don't know if you saw the graph where it shows that midnight onwards, the babies stop colicky symptoms. But if your parent is coming to you saying they're up all night, they're screaming, they're inconsolable, and what happens is they literally pass wind, and the wind is painful and uncomfortable, then that nighttime sleep, especially after 12 to 14 weeks, it might be an indication, because these families have really poor quality of life. Late diagnosis. So if they're presenting to you, the baby with cow's milk allergy, and they're just about to go on to solids, you want control quickly and then allow them to go on to solids, because otherwise you're going to end up delay introduction of complementary foods. And if you're breastfed, again, that was already an indication for amino acids. So weaning, late diagnosis. I like this one. I think if a mum is dumping her immune system in the last trimester of pregnancy, but your child who's got milk allergy is presenting with infection after infection before the age of 6 months, then we think that infections might be a clue that this child is more likely to be more immunodeficient and